Yes. Thank you so much.
Yeah. Yeah. I could stand it if I'm talking to somebody because that shit matters. But if I'm just sitting there doing nothing, I can't do shit.
Of course you may. Okay, thank you. You know what? My one of my sponsors. It's amazing. I have everything, but I don't think. Here we go. Kind of. The only thing I'm not feeling concerned about is the value of standing more in opposite directions. So that's kind of like a values are really Danielle. Let's grab a poster. But it's long, you can't like.
All right, hey everybody. My name's Judy Schley. I am a family doctor. I've been at Denver Health. This is my 35th year. So I call myself a lifer at Denver Health. I am the Associate Director of the Public Health Institute at Denver Health and the Medical Director for the Center for Addiction Medicine. And my pronouns are she, her. And now my colleague.
Hello, everyone. Welcome. Thank you all so much for being here with us today in recognition of International Overdose Awareness Day. My name is John Mills. I use he, him, his pronouns, and I am the public health planner with the Center for Addiction Medicine, and I've been with Denver Health for 6 years.
So, yes, we love each other.
There's a lot of love going on in here.
Yeah, no, this is an exciting day for us. So I want to thank you all for being here and joining us in this event. We have some things out here for people to learn about the Center for Addiction Medicine, other areas related to overdose awareness, and then also some paraphernalia for naloxone, fentanyl test strips, and other things to raise awareness and to keep people safe. So as you know, this is an international day that we recognize for the country. What we're trying to do with the Center for Addiction Medicine and for all the things we do in all the areas of Denver Health is to raise awareness about overdoses, get people into treatment, and save lives. That's very, very important. This past year in Colorado, we lost, and you can see the flags that are associated, we lost 1,881 people. That is a horrible statistic, one we should never see. And we need to do more to help and avoid people dying from this. And that's what we do at Denver Health day in and day out all over our institution. So with that, I want to take one moment and just remember the people that we have lost.
Thank you, everyone. Like Judy mentioned, here at Denver Health, we are extremely committed to addressing this public health epidemic. The Center for Addiction Medicine was established in 2018, and our primary goal is to increase the essential health services for individuals with substance use disorders. Our extremely successful hub and spoke model is an integrated behavioral health services approach to reduce barriers, increase services, but truly, it highlights our services. But as you all know, it takes a village, and we are nothing without our community partners. Being able to tap into a network of community agencies to continue to deliver treatment to individuals when and where they need it is extremely important to what we do. Now let's get into our program, y'all. Y'all ready? Let me get some energy from y'all. Yes! So to start us off, I'd like to introduce you to Wanda and her partner, Jason. They've been through a lot, and they want you to hear a little bit more about their story and their journey of recovery, support, and community. Please join me in welcoming Wanda and Jason.
Hello, everybody. My name's Wanda Prince, and my pronouns are she, her. And I wrote a speech for this event today, so I will start. According to the Colorado Department of Health and Public Environment, drug use disorders and fatal overdoses remain a significant public health concern. Deaths involving synthetic opioids other than methadone, such as fentanyl, have increased nationally since 2013 and have risen in prominence in Colorado since 2016. The Colorado Department of Public Health and Environment is monitoring the severity of the epidemic using a variety of available data, including mortality data from death certificates registered in Colorado. From 2010 to 2020, there were 10,334 deaths from drug overdose among Colorado residents. And during this time period, rates increased nearly every year. In 2010, the number of total overdoses was 653 residents, which is 12.6 deaths per 100,000 population. In 2020, the number of total overdoses more than doubled to 1,477 residents, which is 24.8 deaths per 100,000. Until 2015, Colorado's rate of overdose death was higher than the national rate. However, the national rate has exceeded Colorado's rate since 2015. Both Colorado's overdose death rate and the nation's rate has continued to increase in the most recent years of data available. The 2020 data indicates a marked increase in Colorado's overdose death rate, and though official 2020 age-adjusted rates are not yet available for the United States, provisional counts also indicate a continued increase. Similarly, opioid overdose rates increased from 2010 to 2020 for both Colorado and the United States, and are a contributor to the increase in total drug overdose deaths. The opioid overdose rates began to increase, notably after 2013 in the United States and after 2018 in Colorado. Now that you've heard the scary and heartbreaking statistics, let me tell you that I am living proof that we do recover. Thank you. I used heroin mainly, but other street drugs as well, for well over 15 years of my life. I saw overdose, death, jails, institutions, prison, crime, you name it, I saw it. I lost myself, my children, my family, and in 2018, my husband and I walked out of Denver County Jail with nothing but the clothes on our backs and sobriety. I had just had our son in jail and he was in foster care. I came out of jail on the methadone program, and my husband and I have now have almost 6 years completely clean and sober. Thank you. We have our children back, our life back, and most importantly, freedom from addiction and overdose. My husband and I have worked hard to maintain sobriety, and we are proof that both methadone and Suboxone do work. I've used methadone and my husband's used Suboxone. I will be the first to admit that it's not an easy road, but it is absolutely possible and attainable if you want it. My husband and I are now 3 months away from graduation, where we will have a bachelor's degree in human services with a concentration in substance use counseling, so that we can turn our trauma into triumph and use our real life testimony to help save lives and lower the overdose statistics. Overdose is scary and real, but most importantly, it is a real part of this harrowing addiction. But the good news is that recovery is real and obtainable, and with hard work, we can change the addiction and overdose statistics.
Thank you so much. All right, now next we have our illustrious, wonderful Dr. Scott Simpson, and he's the medical director of the Psychiatric Emergency Services, and he's a CAM, Center of Addiction Medicine champion. So thank you, Scott.
Thank you, Dr. Shaw. Hi, I'm Scott Simpson. I'm a psychiatrist here at Denver Health. I've been at Denver Health for 8 years. My pronouns are he, him. I'm the medical director for Psychiatric Emergency Services. And I just want to, again, I don't know where she went. I just want to, again, thank you, Wanda, for sharing your story, because that's so powerful, so meaningful. When I saw the latest overdose death data from Denver and Colorado, I was taken aback. So in the last 2 years, the incidence of drug overdose deaths in Denver has more than doubled, even after adjusting for population growth. We've seen more than a doubling in opioid-related overdose deaths. We've seen methamphetamine-related deaths almost triple. And while these numbers and the numbers that Wanda and Dr. Schley and John shared are shocking, my next reaction is sadness, because these numbers represent loved ones, family, friends, coworkers who have died in the course of this epidemic. Today, Overdose Awareness Day is a moment for us to recall the personal losses of this epidemic, and it is a moment for us to reflect on the need to do better. I'm proud to be a physician at Denver Health for lots of reasons, and today I'm proud to talk about how our more than 100 psychiatrists, psychologists, and counselors all across the Denver Health system are making addiction treatment available to everyone in our community who wants it. Woo! The work that's happening here has truly given me hope. And I have hope because treatment is more available than ever. At Denver Health, we've started almost 700 persons on life-saving buprenorphine or methadone treatment through our city-sponsored treatment on demand program. We will treat you no matter who you are, whatever your story is, and whenever you are ready for treatment. I have hope because our public leaders get it. And John began to talk about how important our public partnerships are to the work we do at Denver Health. In my nearly 20 years of medicine, I've never seen so much commitment and dedication to making addiction and behavioral health treatment possible. We count on our partners with the City of Denver, the Office of the Mayor, to make what we do here possible. We've seen the DEA make it easier to prescribe Suboxone. We've seen the state step up and make naloxone freely available to everyone who wants a Narcan kit. I also appreciate the support that our leaders here at Denver Health provide to our physicians, our nurses, our counselors, and our staff to do this work that we do. And I have hope because our treatments are getting better. We all know that fentanyl has come to Colorado, but using fentanyl does not need to be a death sentence. We have learned how to adapt our treatments, Suboxone, methadone, naloxone, to fentanyl, and we have treatments that work, just as they work for alcohol, heroin, and methamphetamine. We now need every doctor, counselor, community mental health center, and healthcare system in the state to understand how to recognize addiction and help patients access treatment. And finally, I have hope because I see all of us here together. No matter who you are, whether you're receiving care, whether you're ready to quit, or maybe you're just thinking about whether quitting is possible, Denver Health is here for you. And so if you are a patient, a family member, a healthcare provider, please call us and we want to be there for you. Every overdose is a tragedy, and I hope that this Overdose Awareness Day is a moment for us not only to mourn and remember, but also to look forward to saving lives together. Thank you very much.
Thank you so much, Dr. Simpson. A little story. I don't know if Dr. Simpson remembers this, but when I first started at Denver Health as a clerk 6 years ago, I created this little Excel spreadsheet to track intakes into one of our clinics. And somebody said, send it to Dr. Simpson. He will give you feedback. I was so nervous, y'all. It took me probably all day to write up this email. I was like, we have this big league doctor. He doesn't know who I am. I'm going to send him an email. And I finally sent it. And he replied probably in like 30 minutes with like 2 paragraphs of suggestions on how to modify the Excel spreadsheet to make it better suited to our needs. So I talked a little bit earlier about how important our external community partners are, but our internal partners are just as important. So thank you, Dr. Simpson. So next up, I would like to welcome Tabitha.
I guess today our message is hope. Look at this. I have hope in my phone. So I'm super kind of nervous. Even on my index card, it says intro and it has my name, Tabitha. So I'm Tabitha, and a little introduction. You know, when I interviewed for this job, I had not been employed for 7 years due to homelessness, addiction, and being on the streets and stuff. And I interviewed, and I was so excited about the job and doing outreach. I said, you know, if you don't hire me, I'll do the job for free and volunteer. So I'm a substance use navigator. So what that means is I go out into the community and I go into encampments. I go into the encampments and I try to find people who are seeking recovery or mat treatment or whatever the case may be, whatever it is that they need.
And she does a wonderful job.
Thank you.
Oh, she does.
Thank you, and I absolutely love it. So my story goes, I fought addiction for 27 years of my life, and I now almost have 7 years clean. So the benefit experience is that I find that trust is key when working with the community who are experiencing homelessness. And you know, I know that's not the right word to use. You're supposed to use right. And sorry, you got me. Okay, good. I try to be as easy as I can, but you know, it comes down to trust. It comes down to people with experience, because I ride with officers and first responders and other teams, and a lot of people don't, you don't know me, you don't know my story, I don't want to engage with you. But when it comes to peer support and reaching out to people like that, they're like, okay, I'll talk to you. You understand what I'm going through. When I explained a little bit of my story to them, they're like, okay, you can listen to me, because that's what it comes down to. They want to be heard. They want somebody to listen to their story. You know, not just somebody here, I'm going to tell you what you need, because it's not what it's about. It's whatever kind of services they want, you know, where they want to go, where they would like to be treated. So it's important to have be empathetic and understanding and relatable. You know, they would like people to be relatable to them. So being a good listener, because they like to be heard. I believe, because I like to be heard when I was out there, you know?
Isn't she just an angel?
Oh, thank you. Can you tell I'm nervous? I'm so sorry. So, you know, what it comes down to, the perspective of my job is I was born to do this job. Like, I might be nervous talking to you guys in front of cameras, like Jennifer, and stuff, but when it comes down to it, I can talk to a stranger all day long. I could engage like nobody's business. You know, I would honestly be out there talking to someone right now than talking to you guys. But in helping. I will go as far as I can to help somebody in need. That's what I'll do. I will stay long hours and start early mornings just to help somebody who's reaching. Please help me. You know, I need someone to help me, and that's my calling. It's a desire that's been placed in my heart. Is community work. Absolutely love community work, and that's what it comes down to. Because it's an honor. It's an honor and a privilege to answer to a cry for help. An absolute honor and a privilege to do that. I may not help everybody all the time, but I do believe that my job entails planting seeds of hope.
Don't let her fool you. She helps all the time.
I do believe that. Because in the moment when we're out there with first responders and the people are like, no, not now, but I do get this all the time. Do you have a card? I do not want to talk to you in front of these people right now, but do you have a card so I can reach out later? Where can I find you at? You know, the SUN program has taught me a lot. It has taught me a lot. It has taught me to grow as a professional, because I was an addict out there for 27 years of my life, right? And I found recovery and I found a new way of life, but I didn't do that by myself. I did it by support of the community. I did it by support of others and people showing me how to live and how to grow, and by asking questions, you know, and that's how it is. So to be honest with you, it takes a village. It takes community to support, to help one person. You know, I am a strong believer and advocate that it's wraparound services are vital to the success of teams working together. It's not me. It's all about teams coming together, you know. So networking is essential, I believe. I would not be good at my job at what I do if I didn't network with other communities and organizations in Denver. You know, so I'm a very strong advocate for that. I am tied with lots of other organizations and the teams at Denver Health and the Treatment on Demand and everything. So, you know, you guys, thank you for letting me share end to end. I know change is possible. I'm proof of that. Support and caring for people and advocacy is everything. All right? I'm a strong inspiration.
Well, before we go on to our final presenter, I just want to, first of all, we have a couple of executive staff members here. Lorraine Zimmer, where's my good Chris Goff? She's around here somewhere. All right, yeah, she's a real champion, both these ladies are. And then to our, we have a lot of people that we work with, Sobriety House, Hazel Miller, other groups that are really important as we talk about a network to make this really successful, to help people. And then I want to call out Denver Department of Public Health and Environment for their support for the shirts and all the Narcan and all that stuff. Thank you very much. And they support the treatment on demand and the substance use navigation program. Really important things that really help people. And so now, you know, everybody, we have naloxone out here, we have fentanyl test strips out here. People don't know how to use this stuff. It's really important to know how to use it. So my good buddy, Dr. Hermione Hurley, who I adore, she's really powerful. She's going to teach us all in 5 minutes. No, but it's a part of the process. She's going to help us be aware, and then we can then learn more later.
This is my American accent. I want to give a shout out to Pat Kay. Who's got Pat Kay out there? Give a shout out to Cam. Who's got Cam? How about any other part of Denver Health? How about people with lived and living experience? How about any New Zealanders? I'll take an Australian. Yeah, or any colonial. Okay, here I am. Okay, so I'm now going to reach into my pocket and try some stuff out. Okay, things are not perfect in this world, and the setup is also not perfect. I'm now going to role model using a pea stick to test your equipment. Okay, here we go. Here's my table. Yeah. I need my both hands, so I'm going to ask my fine friend here to be my helper. Alright, things aren't so great. I actually don't trust my Tums today. I'm not convinced that this is a good Tums. I'm worried it might have fentanyl. So I'm going to pull my bottle of water. Maybe I've got a cooker. Maybe I've got some sterile water. I'm going to give this a go. I'm going to take the cap off my bottle. I'm probably going to spill it on myself. I don't carry cash, but I happened to find this old coin. There it is. Is there actually a $5 coin, or is this a prop? Alright, I'm now going to break my pill in half. If I had it in a baggie, I could just crush this pill in the baggie. That would work. But in the meantime, I like the good stuff in the middle of this tongue. So I'm going to scrape it into this hole here. I don't know, I'm scraping. Little scrapey, scrape. I'm putting the rest of my Tums in a safe place. And I'm getting out my fentanyl test strip. It doesn't have to be this one. They all have similarities. Check out how yours work. Thank you, kind friend.
Of course.
I'm now going to tip a little bit in here, not too much. Because I'm testing a pill. Oh, some of it got in there. Alright. I've opened my strip. And inside, I'm finding this thing that we normally didn't pee. So here it is. Okay. I'm looking for the wavy end. This bit here has got some little waves on it. And I'm now going to dip it and roam it around and swish it all up there. Our kind friend, could you sing Happy Birthday?
Happy birthday. Happy birthday to you. Happy birthday, dear somebody. Happy birthday to them.
Now I'm putting it horizontal. And I'm watching and I'm keeping this bit because I always forget things. And it's going to help me interpret it. Kind friend, do you have my bag of stuff?
Right here. Thank you for the reference, family. Yes.
Here is my homemade baggie with baking soda in it. I'm open to actually peer critique afterwards. Please come and tell me I'm trying this on. If I think this bag quantity is something like cocaine or methamphetamine, I'm being pretty cautious. I only need a tiny amount. Otherwise, I might get a false positive. So I'm getting rid of what I'm going to need to use, and I'm leaving just a residue in here. Open this. Alright. My scotch tape doesn't come off because then it's going to leak. I'm emptying the stuff. Thank you, my friend. I'm opening my other baggie and getting the ready. Oh, I'm not doing this very well, obviously. But one thing I'm not freaked out about is it touching my skin. It's a myth that you're going to die if you're touching fentanyl. Do what you need to do to keep yourself safe, but you're not going to die from touching it. I'm still okay. Right? I'm messy, but I'm okay. I'm trying to tip this into my homemade baggie. It's going to leak. Alright. Squishy mushy, squishy mushy, squishy mushy. Alright. In goes the tip. Quick singing. Oh, quick up.
Happy birthday to you. Happy birthday to you. Happy birthday to somebody. Happy birthday to them.
And we're waiting. John, are you okay?
I'm okay.
Are you really okay?
I am maybe not okay.
No, that's right. John, I'm concerned that you are having trouble breathing. Right. Brooke, where are you? Please call 911. I'm really worried I'm going to need some help getting John recovered. John, I need you to get into a safe position. It can be on that chair because you don't want to lie on the ground. Okay. John, it seems to me that you are not breathing well, that your respiration is becoming labored. Maybe you're a little blue in that beautiful face. I'm not receiving a response. Stop smiling. And then I'm really concerned. I know that I'm worried about my supply having some fentanyl in it. I'm going to give Narcan. I am peeling. I am taking out of the bin. I am holding. I am putting it in his nose, aiming to the back of his head, and I'm squirting it all in one rapid push. Whoop. Sorry about that. In his nose, not his face. I am now putting him into the recovery position, and because I truly like him, I'm also ready to give him some airway support or a couple of rescue breaths. John, how are you feeling? He's recovered. I'm still getting the great. I've got a second one if I need it. All right.
And this is what it looks like in the box.
Now I'm going to check the strips.
You're doing great.
Here we go. Now I can see this. So I'm going to stand up. Here. All right. So there are two little lines here. Remember, this is a pea stick that we're appropriating to help and look for things. Is this the only thing you should use in your decision making? No. You need to think about your own safety, who you're with, what to do. 2 stripes is negative. If you can't remember that, look at the green thing and it'll tell you. How do I remember that? No has 2 letters in it. 2 strips is negative. Hey, if it tests positive, you've got a choice to make. Are you going to use less? Are you going to make sure someone's around? Are you going to have the Narcan in your kit so someone could help you? Or are you going to just go away and wait another day? So this is a piece of information to add to all the other things you know about yourself and your safety. Stay alive, and when you're ready to see us, we're ready to see you. Thank you.
Didn't she do a great job? Fentanyl test strips and naloxone treatment in 5 minutes. All right, we're going to wrap this event. I'm going to let John do the honors.
Hello. Let's give it up for Dr. Hurley one more time. As we are wrapping up our proceedings, I just want to thank all of our speakers and everyone here today for joining us in recognition of International Overdose Awareness Day. As Judy mentioned before, we have our purple flags that are placed here in recognition of the 1,881 overdose deaths in Colorado in 2021. We thank you all so much for coming and joining us today. This year we won't be doing a march, but we do encourage you to support our community partners at the Harm Reduction Action Center, and they will be hosting an event from 1:30 to 4 today in recognition of Overdose Awareness Day. Their address is 112 East Avenue here in Denver. So thank you all so much for joining us, and I hope you all have a wonderful day.
And come and look at all the things. We have some shirts if people want a shirt or information about various things, as well as, I think the naloxone's already been used, but we have fentanyl test strips and we have other products that people can take. So thank you very much for attending.
Thank you.